Syphilis is a sexual transmitted disease. It can lead to a range of painful, chronic, and deadly symptoms such as infection in the nerve system or cardiovascular complications. In 1932, the Public Health Service, working with the Tuskegee Institute, began a study to record the natural history of syphilis in hopes of justifying treatment programs for blacks. It was known officially as the Tuskegee Study of Untreated Syphilis in the Negro Male, and the study began at a time where there was no known treatment for the disease. The study was funded by Rosenwald Fund. This experiment remains one of the most appalling instances of government-sponsored mistreatment of black people. The study was performed in Macon County, Alabama. Of the 600 men in the study, 399 of them were infected with the actual disease, while the remaining 201 were given placebos. These men were all from poor communities, they were all African American sharecroppers, and they were all lied to. They were duped into thinking they were receiving treatment for bad blood, a vague term used for a variety of conditions at the Tuskegee Institute. The study was projected to last 6 months, but ended up going on 40 years, and for 40 years, the U.S. Public Health Service studied the effects of untreated syphilis in those men, purposely leaving them sick. The reason behind the study was to see the full effect of the disease on the human body. And although the men were not informed of the actual experiment they were doing, they were told that they would be given free food, free doctor checkups, and even burial insurance for participating. So many easily agreed to be in the study. The Henderson Act, which was passed in 1943, required that all venereal diseases be tested and treated. By the late 1940s, all healthcare services in the U.S. had implemented the act, but only in the Tuskegee syphilis experiment, treatment was denied. By 1947, penicillin became widely accepted as treatment after initial studies in 1943 showed it to be effective, yet they were not giving these black men the treatment, and they kept the families in the dark about the true nature of the study. The experiments continued, leading to the spread of the disease among the men's families, including their children. As time went by, many of them fell into horrible states of distress from the sickness. Some men went blind, some died, while others even went insane, aside from other health issues. In the end, 28 men died directly from syphilis, 100 died due to related issues, 40 of the wives contracted the disease, and 19 children were born with congenital syphilis. The last experiment participant died in January 2004. Peter Buxton, who was a public health service investigator of venereal diseases in San Francisco, became really concerned about the ethics and morality of the study in 1966. There are 6 main points which are regarded as highly unethical in the study, 2 of which were there was no informed consent and the participants were not informed of all the known dangers. Finally, in the 1970s, after years of being blocked out by his peers, he went to the press, and on July 25, 1972, Washington Star broke the story. On July 26, the story made it to the front page of the New York Times. The study ended in November 16th of 1972, 25 years after the cure was known and publicly available. In the summer of 1973, a class action lawsuit was filed on behalf of the study participants and their families. In 1974, a $10 million out-of-court settlement was reached. As part of the settlement, the U.S. government promised to give lifetime medical benefits and burial services to all living participants. The Tuskegee Health Benefit Program was established to provide these services. In 1975, wives, widows, and offspring were added to the program, and in 1995, the program was expanded to include health as well as medical benefits. 2 years later, Congress passed the National Research Act, which helped develop proper guidelines for human subject research in light of what happened at Tuskegee. On May 16, 1997, President Bill Clinton offered a formal apology to the study participants on behalf of the United States government, and rightfully called the program racist. The Tuskegee experiment caused immense tragedy to hundreds of people, and the scientists conducting the study showed a sheer lack of ethical consideration. And although reparations were paid, the damage was already so far gone for most.
Work every day till we meet ends. Half it turn it up on weekends. Boss a toast to your real friend. Tell me what you're drinking now. Hey, he running up all the money.